Welcome to Lesson 2 of the Elder Tree course on living well with chronic pain. Today we'll talk about the role of medications in treating pain. Many people with chronic pain manage well without pain medications. If you do use them, though, you're not alone. Over 10% of American adults have taken a prescription pain medication in the past year, and more than 80% have taken non-prescription pain relievers. You may already know some important truths about pain medications. First, some people struggle to get the treatment they need, and they have to worry about being stereotyped or distrusted when they seek out medication for their pain. That shouldn't happen. But it's also true that even the most powerful medications rarely get rid of pain completely, and for most people, medication is not the whole answer to chronic pain. Pain medications work best when they're part of an overall plan to manage chronic pain. A key part of that plan is to be informed about the medications you take. By the end of this lesson, you'll have answers to these 3 key questions. What kinds of medication are available for chronic pain? How can I be sure I'm taking medication safely? And how can I get the most out of my medications? We'll start by taking a look at the benefits and risks of medications that are commonly prescribed for chronic pain. How should these medications fit in your plan for managing pain? We'll talk about that too. Every medication has some risk, even the ones you get without a prescription. That's why it's important to understand all of your medications. If you're older or you have a chronic health condition, it's even more important. Here's why. First, all medications can cause side effects. They can also cause problems by interacting with each other, and older adults are more likely to have multiple prescriptions. This makes both side effects and interactions between medications more likely. Also, older adults tend to get prescriptions from more than one doctor. That makes it harder to keep track of what you're taking. And finally, the normal aging process can affect how your body handles medications. They may stay in the body longer, or you might also be more sensitive to certain things you take. You or your doctor might blame symptoms like weakness, dizziness, or upset stomach on aging, when in fact they could be caused by something you're taking. Most side effects are minor, but some can be serious. In fact, for older adults, nearly 1/3 of all hospital stays involve problems with medications. The good news is, a little knowledge can keep you a lot safer. Let's review what you've learned so far with a short quiz. Question 1. True or false? Taking multiple medications increases your risk of side effects and interactions between medications. A. True, or B. False? The correct answer is A. The more medications you take, the more likely you are to experience side effects and interactions between medications. Question 2. How can aging affect the way your body handles medications? A. Medications may stay in your body longer. B. Your body may process medications differently. C. Both A and B. The correct answer is C. As we age, medications may stay in the body longer. Our bodies also may process them differently. When it comes to medications, there are 2 facts you should know about anything you take. First, what is the active ingredient? In other words, what makes this medicine work? The same ingredient can be part of many different medications. For example, the pain reliever acetaminophen is in lots of popular cold and flu remedies. This means there's a risk of taking more than the recommended dose by accident. Read labels to identify the active ingredients of any medications you take, including the ones you take for something other than pain. Second, What are the other names your medication goes by? The same medication can have a brand name, such as Motrin, and a generic name, such as ibuprofen. Medication labels may show one name or both. Knowing these two facts about your medications, their active ingredients, and their generic and brand names, allows you to learn more about their benefits and risks. The 6 groups of medications pictured here are often prescribed for chronic pain. These are acetaminophen, or Tylenol, ibuprofen, such as Advil or Motrin, COX-2 inhibitors, antidepressants, anticonvulsants, and opioids. Each works differently and carries its own benefits and risks. To learn more about any of them, see the additional resources offered with this lesson. Pills and capsules taken by mouth are not the only medical treatments for pain. Some medicines can be applied directly on your skin. Many of these, known as topical medications, are available over the counter. The word analgesia means relieving pain. Over-the-counter analgesic creams limit your nerve's ability to transmit pain signals. They work locally, that is, only where the cream is applied. One type of analgesic cream contains capsaicin, which is made from the seeds of hot chili peppers. Other creams contain salicylates, a chemical similar to aspirin, or numbing agents such as lidocaine and benzocaine. Topical analgesics also come in prescription-strength creams and patches. It's important to remember that even when a medication is applied through the skin, it can still have side effects, such as redness, irritation, or in rare cases, allergic reactions. Also, read labels to learn of any precautions before using them. For example, most topical medications should not be used if skin is cut or irritated. Some medications can be delivered by injection. The injections are given near the location of the pain in a specific joint, muscle, or group of nerves. 2 types of medication are most often used for injections: steroids, which help reduce inflammation, and local anesthetics, which help block pain signals. Both usually work only temporarily. They can help reduce pain while you're receiving physical therapy for longer-lasting relief. Nerve stimulators are yet another option for pain treatment. Nerve stimulation can be applied using electrodes on the surface of the skin or through implants inside the body. The stimulators produce electrical signals that disrupt pain signals and may cause a tingling or buzzing feeling. They don't completely block or eliminate pain. The goal is simply to make the pain easier to tolerate. Medication mistakes are easy to make. The instructions for taking your medication may be confusing. You might accidentally mix one medication up with another, or one of your doctors may be unaware of other medications you're already taking when she prescribes a new one. Luckily, it isn't hard to avoid the most common mistakes. A little extra care goes a long way. First, talk with your doctor. Your doctor wants you to know about the medications you take and should be glad to answer your questions. Whenever your doctor prescribes something new, be sure to ask, "What is this medication for? When should I take it? How much should I take each time? What are the risks of taking this medication? Is there anything I should not eat or drink when I take it? Is it safe to drive while I'm taking this? Is it for short or long-term use? And how do I stop taking this medication?" Next, keep in mind these 10 important tips for avoiding medication mistakes. 1. Keep a list of every medication you take, what it's for, the amount you take, and when you take it. Include not only your prescription medications, but also any over-the-counter meds, vitamins, or supplements you take. Vitamins, supplements, herbal remedies, and over-the-counter meds sometimes can interact with prescription medications. If you use liquid medications, patches, puffers, or medicated creams or ointments, put those on your list too. Also include other things you may use for pain, such as alcohol or marijuana, because they can interact with medications as well. Keep your list in your wallet, purse, or phone in case of emergency, and show the list at every appointment you have with a healthcare professional, including your dentist. You can find tips on making your list in the Elder Tree Health Library anytime after you complete this lesson. 2. Store all your medications in one place. Be sure the spot you choose is well lighted so you can read the labels easily. When medications are stored in more than one spot in your home, it's easier to lose track of what you're taking. 3. Organize your medications once a week, or every day if necessary. A pill organizer with compartments for each dose you take per day is a good way to keep track. Organizing your medications can also help you plan in advance for needed refills. 4. Check the medicine label each time you remove a pill from the bottle. It's easy to mistake one bottle for another, especially at night or when you're in pain. 5. Don't take more than the recommended or prescribed dose of a medication. If you miss a dose, check with your doctor's office about what to do. 6. Never mix opioids with alcohol, antihistamines, or sleeping pills. All of these substances can slow breathing. Combining them could slow your breathing too much. 7. Avoid chewing, crushing, or dividing pills unless your doctor or pharmacist tells you to. This can make the medication less effective or cause too much medication to enter your system too quickly. 8. Don't take someone else's medication. Even if you've been prescribed something similar, it may be different in formulation or strength. 9. Talk to your doctor before stopping a medication. Many meds, including antidepressants and opioids, must be discontinued gradually to prevent dangerous or uncomfortable symptoms. And 10. Try to use the same pharmacy for all of your prescriptions. This can make it easier for your pharmacist to advise you about possible drug interactions or other concerns. If you need to use more than one pharmacy, show each pharmacist your medication list when you drop off your prescription. A pharmacist can help in more ways than you might think. Tell your pharmacist if you have trouble reading your medication labels. You may be able to receive labels that are easier to read. If you have difficulty opening your medication bottles, the pharmacist might be able to use caps that are easier to remove. Also, let the pharmacist know if you have trouble swallowing your pills. Smaller tablets or liquid forms of the same medication might be available. Your pharmacist is also a good resource if you need help identifying a pill or if you're not sure of how or when to take your medications. The pharmacy can also advise you on how to safely dispose of medications you no longer need. Let's review what you've learned so far with a short quiz. Question 1. It's important to keep an up-to-date list of all medications you take. In addition to medications prescribed by your doctor, what else should be on your list? A. Any vitamins or supplements you take. B. Any over-the-counter medications you take. C. Any herbal remedies you use. D. All of the above. The correct answer is D. Include vitamins, supplements, over-the-counter medications, and herbal remedies on your list of medications. All of these can cause side effects or other problems. Question 2. You have forgotten to take last night's dose of a new medication. It's time for the morning dose. What should you do? A. Just take twice as much right now. You need to make up for what you missed. B. Check with your doctor or pharmacist about what to do. The correct answer is B. Check with your doctor or pharmacist about what to do if you miss a dose. Taking more than your prescribed dose at one time could cause problems. Living well with chronic pain means being more than a patient. It means taking an active role in your recovery process. This includes making decisions together with your doctor about the role medication plays in your pain management plan. Like almost all drugs, medications for pain often involve trade-offs. A medication may help relieve pain but create new problems such as fuzzier thinking or other effects that impact your quality of life. When is treatment truly effective? When it does more than reduce or take the edge off of your pain. A successful treatment helps improve your overall health. It allows you to participate more fully in life. If you're taking pain medications, these questions can help you evaluate them. Can I concentrate? Can I enjoy other people's company? Am I more engaged in life? Can I live with the side effects? On the other hand, some signs suggest that your medication plan may need adjustment. For example, taking more and more medications to treat side effects, feeling less interested in being with others, feeling less interested in activities you used to enjoy, becoming more irritable. Your pain seems to be increasing, or you need higher doses to manage your pain. Any of these can be a sign to talk with your doctor about rethinking your pain treatment plan. Even when storms are raging around us, or when we feel stuck in problems or pain, we can find a space within ourselves that's safe and calm. With your eyes lightly closed, imagine a place that's cozy and warm, a place where it's possible to enjoy the beauty of the snow and the gentle way the flakes float on the air. Now, bring to mind a moment at any time in your life when you felt completely safe and accepted. This might have been a moment with a friend, a child, a parent, or a teacher. It might have been a moment with a pet, or a moment in nature. Maybe it involved a smile or a kind word, or maybe it was just the peaceful feeling of being in a place where you felt totally welcome. Rather than simply recalling this experience, allow yourself to really feel it again. What was it like to feel totally safe? Maybe you felt loved or cared for. Or maybe it was a moment when your heart felt light, when you felt completely okay. As much as you're able, let that feeling of acceptance spread through your body. Let it warm and soften your heart and chest so you can breathe a little more fully. Let this feeling of warmth and safety seep into any places in your body where you feel tight or stuck. Let it sink into your shoulders and allow them to relax. Let it flow into your lower back or knees or belly. Let it radiate to any place in your body where it's needed. You don't have to push those stuck places to be any different than they are. As much as you can, just allow the warmth and acceptance of your experience to soak into each part of your body, letting it bring a feeling of kindness and comfort with it. Now, just allow yourself to spend a few moments feeling warm, accepted, secure, and safe. Take a minute to check in with yourself. How did the meditation feel for you? If you found it even a bit helpful, make it a point to remember the moment you chose for this meditation, or think of one or two others when you felt cared for. You might jot a few details about them in your journal if you keep one, or just post a few words about them on your refrigerator. Remembering one of these warm experiences is something you can do whenever you're feeling stuck, or when some part of your body feels tight or tense or painful. Bringing to mind moments of true safety and acceptance as vividly as you can and on a regular basis is one small way to start steering out of the cycle of chronic pain. What's ahead? In the lessons to come, you'll learn more about getting unstuck, especially from situations that can prompt your brain to increase pain. In the meantime, we hope you'll share your thoughts in the ET discussion group or check out more information on medications in the ET Health Library. You can also listen to today's and other guided meditations as often as you like. They're always available for you on Elder Tree. We'll see you again soon.